Is so important to us at this time. So is our mental health. And in fact, what we understand is that our physical and our mental health are interconnected. I'm Janet Kincaid, a communications officer at the World Health Organization here in Geneva, Switzerland, and I'm pleased to be joined today by my colleague, Devorah Kestel, Director for Mental Health and Substance Use here at the World Health Organization, and by our WHO Goodwill Ambassador, Cynthia Germanotta, co-founder of Born This Way Foundation. Good afternoon, ladies, and welcome.
Thank you. Good afternoon.
Thank you.
So let's start with you, Devorah. We've been now in this pandemic for about a year and a half, going into our second year here. It's been impacting all of us, our health, our well-being. We're locked down, we're restricted in our movements, we don't have access to vaccines, we miss our families, and we want to see people. How much do we know about changes in people's mental health in the last year?
Well, thank you, Janet. We know, we hear a lot about the impact on mental health of people for all the reasons that you mentioned. And there have been increase in signs of mental health challenges, whether it is depression, anxiety, different forms of stress, as well as some less good strategies to cope with those challenges that could be a high consumption of alcohol or substance use, which will in itself generate other challenges. Some of the statistics that we manage are changing depending on when a certain survey was done or what was the specific group. We know that some age groups have been more affected than others, children, adolescents, but also the elderly or people working in particularly demanding conditions right now, such as the health workforce. So when we look at the global data that we manage today, we see that there is an increase, for example, on people with depression that goes from 15 to 48% of the population assessed at that time with depression. And similarly with anxiety, it goes from 6 to 50, around 50. So there is a significant increase in many contexts, but some of those numbers could come down as soon as the situation gets a bit back to what we call normal, right?
Yeah. Good to understand, and that's really interesting information. Cynthia, it's good to be with you today. As the co-founder of Born This Way Foundation, what I'm curious to know, especially in terms of your work with the mental health of young people, is how have things changed in the last year? What's different?
Well, thank you, Janet, Devorah, and also World Health Organization for shining the light on this important issue. What we've seen the past year has just been so different, and it's what we call a time of firsts, as well as a time of unknowns for so many, myself included, and it's certainly has impacted young people in a very, very big way because we're figuring things out in real time, as we go. And young people across the globe, especially those of marginalized communities, were already facing significant challenges long before the pandemic. But, as we all know, have been exacerbated not only by the pandemic, but what we see as overlapping crises due to ongoing social and also institutional factors. But what we're seeing is just young people whose lives have been completely disrupted, causing increased isolation, loss of connections, and also like lost trauma and education, but to the point that we don't know what the impact of this lost education and of trauma will be on their lives. And I certainly know that so many of us, we wake up every day, we open our eyes and have this deep-seated feeling of so many mixed emotions. And I've seen and also learned that both hopefulness and despair are living side by side. And we see it all the time in young people because there's such disparity based upon where they are, how they're coping, and the type of resources that they have access to. And although as Devorah highlighted, mental health, anxiety, depression issues are on the rise, and also suicide. We're also encouraged by and inspired by the kindness and resilience and the optimism that this generation is just continues to show in the face of these crises. And we just released a research report this week called Kindness is Action, and it was conducted by the Harris poll. And interestingly, young people view kindness as the way forward. They equate it with action. It's more than just being nice. And they also believe that a majority of them that it helps improve their mental health. And this was so encouraging to so many of us. And we also see them, although they still rely on parents and guardians, they're turning inwardly for inspiration and also to one another. And they're rising up. We've seen people, a lot of them, Devorah, that you work with, youth in the Philippines and Nigeria, using very creative campaigns and TikTok to talk about mental health and take time, to really think about it. So we're spending a great deal of time helping support these young people, specifically in the area of peer-to-peer education, because they mostly turn to one another and in times of crises. That said, we're still very encouraged by this optimistic generation.
What interesting poll results, Cynthia. I recall as a child being taught the value of kindness. And so I'm glad to hear that this is a value that's being seen and acknowledged as important and is being emphasized. That's really encouraging. Devorah, we find ourselves, as I said a little earlier, increasingly in isolation. Some of us are still living in restrictions and lockdowns in the countries that we're in. I live in neighboring France, and we're currently in our third lockdown with curfews, et cetera. What are some of the things that we can do to cope with this isolation and to deal with being in these restrictions at this time?
Thank you, Janet. You know that I was listening to you and thinking that we should always pay attention to, we should always take care of our mental health. And there are a number of self-care strategies that we should use. In a particularly challenging moment like the one we are all going through, then those activities or that effort is even bigger than in normal circumstances. And we are talking about basic activities that could be relevant or could have an impact on our mental health, such as eating well, doing physical activity, sleeping regularly, setting up a routine that we could respect. We discussed before many people working from home or taking care of children at the same time than attending meetings online and multitasking more than ever. So how do we put some boundaries and limit the working time from the non-working time, and define and remember those things that are good for us in normal circumstances, the things that we enjoy doing. It could be reading a book, it could be a hobby, it could be a specific activity that sometimes could be even going for a walk with a pet that we may have, if going for a walk outside is allowed. Otherwise, things that we can do at home. I think that it is always important that we don't give up. I mean, it is a time that requires a bit a bigger commitment from ourselves in taking care of our own, and also that means being in touch with loved ones, find ways of being in touch. It can be the old phone, doesn't need to be the more sophisticated device, right? And reaching out to others also, because kindness, right? By being kind to others, we are also affecting our own mental well-being. And so those are some of the strategies that one could think about that are accessible to.
Yeah, I certainly have to agree with you there. I had my own experiences earlier this year, in realizing I've got to do a better job of taking care of my mental health. And so a walk every day with my partner and the dog is a really important part of the day. But tell me, Devorah and Cynthia, maybe you as well, how are you following your own advice? What are you doing?
For me, I'm I have to recommit now and then because sometimes it becomes a bit harder to keep up with that routine. So I, for a while, I gave up on my physical activities, and then I restarted some basic or going out for a run or a walk or doing something at home. And I do yoga, which I love, and it helps me in a number of ways.
Yeah. Yeah. So Cynthia, yeah, please. Sorry, please go
Oh,
ahead.
no, no. I was just going to say what I found that worked for me, and I think that's the key, is everybody just finding what makes you happy. Is, I try to ground myself in the morning I just read like an inspirational passage and write in a gratitude journal. It doesn't take a lot of time. It's like 3 things that you're grateful for every day. And that just helps ground me for the day. And then, as Deborah said, I try as much as possible to exercise, whether that's, walking, and I like to walk outdoors in nature, and ballet, which is something that I've done my whole life. But, don't be discouraged. There's some days I do it and I'm happy to do it. And there's other days I do it and I struggle with it. And, it's just those feelings that we're all having and sharing now.
Yeah, it's true. And it's been, in the case of our location here, it's been raining for the last week. So that presents its own challenges as well. Do I go out in the rain? Do I find something another activity to participate in? So, Cynthia, I just
Janet,
want to, yeah,
Janet,
Deborah,
if I
please.
may add something,
Sure.
because I was thinking that we are talking about people affected in their mental health as the majority of us are, but there are those who are really struggling with mental health issues, who may have had mental health issues before, and who have been going through some kind of therapeutic treatment, and that requires some more careful attention that I didn't want to miss, right? It's not just for everybody, everything will work in the same way. So it is also important to seek for help if you feel you need it. It doesn't matter what is the diagnostic or the category or anything. If you feel you need somebody else to help you, you need to reach out for help. And nowadays, one of the positive consequences perhaps of this situation is that there are a number of options in many countries or even internationally in some context online or through phone SOS or similar things. So that is equally important, and I didn't want to miss the
Yeah,
opportunity to
that's such
highlight
an
it.
important point, Devorah. It's one thing for us to be able to do these things, but we work with a partner who was a 4-time suicide attempt suicider, and she said there were days when, the thing that got her through was just having clean clothes, for the day, and that helped her mental health, and that helped her get through. That was what we call our anchors. And I would encourage people that are struggling to find your anchor. Find that one thing that, no matter how small it is, if it's a deep breath or, a cup of tea, clean clothes like it was for Allie. It's so important. So thank you for mentioning that.
Yeah, no, these are really good points. I've always said that some of the best money I ever spent was money that I spent on a therapist. But I recognize too that in this time, not everyone may have access to that kind of resource. And so it's encouraging. I've seen myself that there are resources available to people at no cost or very little cost. But again, too, as Cynthia points out, sometimes just getting up and taking a shower makes you feel better, or putting on clean clothes. So yeah, no, these are really important points, and I thank you for bringing those up. Cynthia, I want to come to you for a moment, because we're often asked, how do you help someone who's struggling with their mental health? In many families and communities, we've just had a very open discussion here. I'm very open with my colleagues and with my friends about the fact that I have a therapist. I'm not ashamed of that. I'm happy to talk about it. But in a lot of communities, or even in families or cultures, this is kind of frowned upon, or is seen as being taboo. So I'm curious to know, what kind of advice do you have for people who might be worried about their families or someone in their social or professional circle? How should we go about approaching those people?
Well, thank you. And it is a very delicate and complicated situation, particularly across cultures, as you mentioned. And I think we have to prepare ourselves for that moment, rather than waiting for it to happen. We talk about being proactive and learning about mental health. I know as a parent, as a mother, I struggled because when it happened to my daughter when she was 14, I didn't really understand the warning signs. So I think preparing ourselves as adults as much as possible so that we can model healthy and open conversations. But when I say model, I mean on a regular basis, not like when you have the one-time talk with a family member about, safe driving or safe drinking, but regularly talking about it as we talk about physical health and making it part of one's total health. Because I think the more that we model those conversations, just like the one that you're hosting today, the more we help eliminate the stigma. And I think secondly is take some time to learn how to help a peer. We've learned from our research that a large majority of young people have helped peers, but less than 40% of them actually felt equipped to do it. And so we have partnered with an organization called jack.org on a tool. It's called bethere.org. I encourage people to go to it because literally in 5 minutes, you can learn how to lean into these difficult conversations and feel more prepared. It kind of teaches you to learn how to say what you see in a friend or somebody that you know is struggling, how to talk to them and how to get them connected to help. But of course, if it's an emergency situation, I think, it's important for us to learn what resources are available in our community. So if we do see somebody struggling, we're educated on where they can go. One of the biggest deterrents for young people to not seeking help is they don't know where to go. So I think that's a role that all of us as adults can play. And I always like to leave with an encouraging comment that in our most recent research, kindness is action. We've learned that 70% of young people now feel more comfortable seeking resources to improve their mental wellness. And a large majority of them are willing to talk about it. And I think that's been, if there's any silver lining, in this situation that we're in, it's this fact and having telehealth services and things like that and apps that young people are turning to.
Yeah, true. Devora, you talk about stress. We talk about stress in our work in mental health and stress management. And of course, we know that we need a certain amount of stress in our lives, but too much stress can be harmful to us. And I'm just curious, what does WHO recommend for coping with stress, particularly in the current situation?
We launched last year a new material that is called Doing What Matters in Times of Stress. And it's a simple guide on how to manage stress, how to deal with the stress, and what techniques are out there that could help those challenges that we all may encounter on a regular basis or occasionally, depending on on each other. And there is a very simple to follow guide with also audio recordings that could also be available, and it's been translated in many languages already, which means people are interested to access it, and just through some techniques that help us learning them and put them in practice a few minutes every day, then we really could overcome those challenges. So I advise everybody to have a look at the material and learn how to use it.
I'm glad that you mentioned the WHO Stress Management Guide, Devora. I actually had a conversation the other day with our colleague, Ken Carswell. He's an expert in stress management. And I actually asked him if he would take a minute and record for us or show us how to do these exercises. So why don't we go ahead and go over to Ken and see what he would advise for us in terms of unhooking and grounding ourselves. Ken, over to you.
Great, thanks Janet. Hello there. So I'm here to show you a couple of brief and easy techniques to help you manage stress and to help you walk the talk for mental health. The techniques come from a guide we've released at WHO, called Doing What Matters in Times of Stress. Techniques are very easy to use and may be particularly important and helpful given the stress that everybody around the world is going through right now and the difficulties that we're facing. The techniques can be used a couple of minutes every day. It doesn't take very long to practice, and with a little bit of practice, a bit like building muscles or exercising, very soon you'll be able to apply them in your everyday life, and hopefully they'll give you some relief and some ability to manage stress. Now, the way that it works is through a couple of techniques called grounding and unhooking. Now, these are used when we get hooked by difficult thoughts or feelings. Now, what do I mean by hooked? Well, being hooked means that we might be doing something that we enjoy, we might be talking to a friend or engaged in our work, and then suddenly a worry about the future, a concern about the past might come to our minds, and we get pulled away from what we're doing. Now, when we get pulled away in that way, it means that we can start doing things that pull us away from what's important to us. For example, it might pull us away from some of our values or what we find important in life. It might cause us to start isolating ourselves from people, start arguments, or maybe even start using drugs and alcohol as ways of coping with difficult thoughts and feelings. Now, these techniques in the guide can be used very easily, very quickly, to help us to unhook from these difficulties. The guide has 5 easy to learn techniques that can help us with the stressful situations, and I'm going to show you 2 of these now. Okay, so the first one is called grounding, and this is something that you can use anytime in your life whenever you get hooked by a difficult thought or feeling or you feel stressed. We're going to run through it now, but please feel comfortable to adapt it to whatever feels comfortable in terms of your range of movements or whatever senses that you have available. Now, the first step to grounding is to notice how you are feeling and what you are thinking. The next step is to connect with your body. So you might slow yourself down, slow down your breathing, empty your lungs, and then let them refill as slowly as possible. The next step is to stretch out your arms, or to push your hands together, or another alternative like pushing your feet onto the floor, so that you really connect with your body. And then it's about refocusing with the world around you in whatever way that you can. So you might pay attention to 5 things that you can see. Or what are 5 things that you can hear? You might breathe the air and notice how it smells. And then you might touch your knees or the surface beneath you to really connect with the world. So you might notice that even with stressful thoughts and feelings that are coming in, you still notice there's a world around you that you can connect and engage with. Okay, so that's a little run through of grounding, and now we can just practice it together. So first of all, just take a few seconds to notice how you are feeling and what you are thinking. And next, connect with your body. Slow yourself down, slow your breathing, empty your lungs, and then let them refill as slowly as possible. And now stretch in whatever way feels comfortable. Maybe stretch your arms out, maybe press your hands together, press your feet into the floor, and now use your senses to connect with the world around you. What are 5 things that you can see? What are 5 things that you can hear? What can you taste? How does the air smell to you? Really connect with the world around you and notice that even though you might be having stressful thoughts and feelings right now, there is a world around you that you can connect with. So that's grounding. And as you can see, it's a very quick and easy exercise. Now on the website and through the guide, you'll notice that we have longer versions of the grounding so that you can practice it for a few more minutes, and then you can apply it whenever you're feeling stressed or having difficult thoughts or feelings to hook you. Okay, so the next technique that I want to show you is even simpler and quicker to apply than grounding, and it's called notice and name. There are 3 steps to it. The first step is to notice. So notice what you're thinking or how you're feeling. And next, name it silently to yourself. Now, what we mean by that is to just say to yourself, I notice here is a difficult thought about the past, or I notice I'm feeling worried, or I notice here is an uncomfortable feeling in my head. Now, it might sound very simple, but just by putting those words in front of it of I notice can give you a bit of space from the difficult thought or feeling that you're experiencing. The next step, it's a bit similar to grounding, is to then refocus on the world around you. So in whichever way works for you and in whichever way is comfortable, connect with the world through your senses, through listening, through looking around and seeing what's around you, by smelling the air, by pushing your feet into the floor, and just connect with what's happening around you at the moment. So now, let's do that together with whatever is happening for you right now. So first of all, notice how you're feeling and what you're thinking. And next, name it. So say silently to yourself, I notice. So I notice I'm feeling worried. I notice I'm feeling stressed. And next, refocus and connect with the world around you. Use your senses, use the physical sensations you can feel to really connect with the world around you. What can you see, or what can you hear? What can you smell, touch, or taste? Really pay attention and refocus with the world around you. And that's it. It's a very simple, quick, and easy to use technique. So I hope you found these techniques useful, and I'd really recommend anybody who's watching this to just spend a couple of minutes to download the guide, and there's some of the audio exercises that go with it. Try them out for a couple of minutes every day and see how they might help you with managing everyday stress in your life. Thanks for your time, and over to you again now, Janet. Thank you.
All right, thanks for that, Ken. I found that really helpful. I hope everyone else did. And this is a good exercise to remember that we can touch things, smell things, hear things, taste things, and use these steps to help ground us, but also to learn what kinds of things hook us. I think it's important to know what happens there. Cynthia, now, I just realized at this point I'm supposed to ask you a question that I already have, and that is, how are you handling stress? But tell us today, you mentioned a gratitude journal, and I'm always kind of intrigued by these, and I start them and then I don't finish them. But may I be so bold as to ask you, what are the 3 things that you're grateful for today? What did you journal today?
Well, one is that I'm grateful for this conversation. I think that anytime we can have them, it's a step toward reducing the stigma. And my second gratitude today will be if somebody else walks away and says that they attended, a conversation like this and also has that conversation. I am grateful at the progress that is happening in the world around the pandemic in particular. I think this is probably one, if not the first time in history, that the entire world is working on the same problem, and WHO is at the center of that. So I'm grateful for that. And I have to say, I'm also grateful for my 93-year-old mother continuing to keep herself healthy and well. But I also think I should say, Janet, it's very deceiving what you see with people. People might look well and calm, and but as my daughter says, we're not just figures in little rectangles on a screen. There are people with feelings, and we don't always know how they're feeling. And there's this always on level of stress that we've had over the past year, because it's difficult to escape it. We have to wear masks and washing our hands and being aware of where we're going. So there's a heightened level of stress and anxiety that we need to just be mindful of for one another.
Yeah, and I think we have to be mindful as well. I sometimes recognize that we get so caught up in numbers that we forget that behind each number is an actual human being. And what has been available to some of us may not yet be available to others. So these feelings of stress and anxiety are going to continue unfortunately, for quite some time for others. But we hope that that will even out and we'll see some more equity in the weeks and months ahead for sure. I just want to mention very quickly that next week is the start of the World Health Assembly here in Geneva. The member states or countries who are members of WHO will be meeting. We'll have more than 200 ministers and representatives from these countries meeting here. And some of the things that they will be discussing include issues around mental health. So, Devora, can you tell us what they'll be discussing and why this is important? Why should people tune in to the World Health Assembly this year?
I think that what we are all feeling and the fear and the concerns and the continuous being worried about what's coming and some more than others because of the living conditions and the surrounding situation, it is a good issue that these nearly 200 member states, countries, have understood that this is that mental health is an issue to take into consideration in the context of the pandemic. And so we have two main issues happening, and one is that the action plan that the World Health Organization has been updated and extended to 2030, which means 10 more years, 9 more years of intensive work that countries commit to do, and that is important. But then there is going to be a discussion specifically about promoting mental health preparedness and response in the context of public health emergencies, including the current pandemic. And this is very important because, again, it's not just what we have been saying, it's not only the physical issues that we need to be concerned about, but it's also mental health. And that means that countries commit to invest more in mental health, they commit to using this current situation as a momentum to strengthen the work that is so much needed in the field of mental health, to ensure that the personnel, the health personnel and social staff are capacitated, trained to deal with mental health issues, and also that there is this engagement, continuous engagement of organizations like Born This Way Foundation and many others, involving people with lived experience to advise policymakers on the way forward. So that is going to be a part of the discussion next week, and hopefully there is going to be a resolution stressing the importance of this area of work that will invite everybody to continue to work in this field.
Excellent. Well, I just have to say, Devora and Cynthia, it's been such a pleasure to meet with you today, to spend a little time with you. Thank you for your time. Also, a thank you to our colleague Ken Carswell for showing us how we can manage our stress through grounding and unhooking. I just want to deliver one final message. Part of what will help us with our mental health and our physical health is to follow all of the guidelines that WHO has put out for this pandemic. Please wear your masks, wash your hands, physically distance from people when and where you can. If you can ventilate rooms safely, please do that. And when it's your turn to be vaccinated, please be vaccinated. These steps can also help you with your physical and mental health as well. So stay safe, take care of your health, and until next time, goodbye.